Hi, everyone. Thank you for joining us for our Gutsy Learning Series webinar on the link between diet and mental health in IBD. My name is Sarah Gandaharian, and I'm the Manager of Patient Programs and Evaluation at Crohn's and Colitis Canada. Before we get started with the webinar, let's run through some technical logistics. This event is being offered in English and French audio. To listen in French, please select Interpretation from your webinar menu bar. This is a globe icon that you will find at the bottom of your screen, and you can select French language. If you experience any technical problems during the event, please try refreshing your website or web browser. You can also comment in the Q&A box found in the Zoom webinar menu bar, and we'll get back to you directly. I also want to take some time to give our disclaimer ahead of today's event. The materials in this presentation are for educational purposes only. They are of general value and may not apply to specific personal medical situations. These online resources are not a substitute for the personalized judgment and care of your trained healthcare professionals. And for those of you who may be joining us and may not be as familiar with Crohn's and Colitis Canada, I want to share our promise, which is to find the cure for Crohn's disease and ulcerative colitis and to improve the lives of children and adults that are affected by these diseases. And I'm happy to announce that this year, Crohn's and Colitis Canada has awarded 15 post-secondary scholarships, which are in the amount of $5,000 with support from IBD. Crohn's and Colitis Canada has partnered with AbbVie Canada in 2012 to launch the National AbbVie IBD Scholarship Program to support students in achieving their academic goals, while they make a lasting and meaningful difference in their communities. Up to this year, the AbbVie IBD Scholarship Program has awarded 124 grants to deserving post-secondary students, and we look forward to continue to support them as they pursue their passions and get involved with causes close to their heart. And a gentle reminder that you can register for our bi-weekly peer support events to connect with other people that are affected by Crohn's and colitis from your community and across Canada. Our online peer-to-peer program provides mentoring and support in an easy, accessible, safe, and confidential space. Our upcoming Gutsy support sessions include an event on October 8th on ostomies and pelvic pouches, which will be offered in English. And we also have a peer support event coming up in French on November 15th. As always, the information and recordings from our Gutsy Learning Series presentations and webinars can be accessed on our website at crohnsandcolitis.ca/GLS. And finally, a quick reminder that if you'd like to listen to this webinar in French, please select the interpretation globe icon in the Zoom menu webinar. Now let's get started. I'm thrilled to introduce you all to our speaker for this evening, Dr. Karen Madsen. Dr. Madsen is a professor of medicine in the Department of Medicine and Division of Gastroenterology at the University of Alberta, and is a Crohn's and Colitis Canada 2021 grant recipient. And for her research project that is focused on discovering innovative forms of treatment for people with IBD. She is also a member of the steering committee for the GEM project and the National Imagine Chronic Disease Network, both that were proudly supported by Crohn's and Colitis Canada. In addition, Dr. Madsen is part of the Women's and Children's Health Research Institute in Edmonton and the Digestive Health Strategic Clinical Network. Her clinical interests include carrying out clinical trials using fecal microbial transplantation and fiber supplements to treat Crohn's disease. She's also a highly cited author and co-author of 250 published research articles and abstracts, with the primary focus of her research being on how microbes interact with the human host and on developing therapies that work by changing the environment of the gut microbiome to treat IBD. One of her current research project studies looks at the effects of plant-based fasting-mimicking diets in people with Crohn's and colitis who are also suffering from depression. We are very excited to have Dr. Madsen talk to us more about this study as she walks us through the relationship between mental health and diet. A lot of appreciation to Dr. Madsen for leading today's presentation. Please take it away, Dr. Madsen.
Excellent. Thank you very much for the introduction. Can you see my screen all right?
Yes, thank you.
Perfect. All right, so let's get started and talk about diet and mental health. So I believe we are doing a poll first. So how would you rate your current knowledge of the gut microbiome in IBD? From none to excellent. You need some music here. And soon there will be an answer. Very soon. Hopefully.
Hi, Dr. Madsen. Just to let you know that you're sharing your screen in the presenter mode, if you don't mind switching it over to audience mode. Thank you.
How's that?
Perfect. Thank you.
Okay. None, very low, low, moderate, high, very high, and some excellent. All right then. Okay. How would you rate your current knowledge of the gut-brain connection? None to excellent. It's coming, I can feel it. None, very low, low, moderate, high, very high, and excellent. Okay, so if you guys in the very high and excellent, this will be a nice review, and hopefully we can learn something. So back in the days of Hippocrates, he said that all disease begins in the gut. He also said that our food should be our medicine and our medicine should be our food. Of course, in those days, he was probably thinking of a diet like this, and probably not a diet that looked like this. Anyway, we know that we need food. I mean, we need nutrients, we need vitamins, we need minerals, carbohydrates, fats, protein to build tissue, fuel muscles, provide energy. But really, how does diet affect mental health? Does it affect mental health? And if so, how does it actually do it? So we're going to talk about the gut-brain connection. So there is extensive communication between the gut and the brain. So it's bi-directional. Brain talks to the gut, gut talks to the brain. And gut microbes really play a huge role in this communication. Okay, so we have really co-evolved with microbes. And every body surface is totally covered with microbes. And they're different. They're different from the mouth, from the lungs, to the skin, to the stomach, to the gut, vagina. Even breast milk has its own complement of microbes that have adapted to life, with us. Indeed, we are really mostly microbial. I mean, we have about 100 trillion microbial cells in our body, and we only have about 30 trillion human cells. And if you look at the number of genes we have, human genes, we have about 23,000 genes that make us who we are. but yet there's over 2 million microbial genes in our body. So if you think about it, there's 99% of genes in our body that are bacterial. And the gut microbiota exists as a balanced ecosystem. And this is really something that we have to understand how it works, because bacteria live there, viruses live there, fungi, archaea, they all live together in an ecosystem. And there's over 50 known bacteriophyla, or different types of bacteria. But generally, there's a balance of 6 main phyla that are found in the gut. And these are bacteria that have really adapted to life within us, as we have adapted to life with them. But it's really a balance. And when we are healthy, we have a really high biodiversity, like a beautiful rainforest of different types of bacteria, mainly within groups called the firmicutes and the Bacteroidetes. However, when we get sick, and this is really seen in most chronic diseases, you seem to lose bacteria. So you have what is called a low biodiversity. So you lose a lot of good bacteria, and you seem to get this increased levels of things like proteobacteria, fusobacteria. And these are associated with disease. Now it's interesting, I mean, people with IBD see a lot of microbial changes in their gut. So a healthy gut, as I said, has a very balanced ecosystem, balance between a lot of different types of microbes. But as IBD develops, patients tend to lose some beneficial microbes, and they tend to start getting other types of microbes that are overgrowing. And as disease progresses, these microbial changes get worse. And when you go into remission, you can go back to having the same type of bacteria that people have when they don't have IBD. Okay, this is just a picture of what it looks like in your gut. So you see all those beautiful colors, those are all the microbes, those trillion microbes that are living in your gut. There's a level of mucus that separates them in the green from the host cells, your gut cells, which are shown in the blue. So you can see how very, very close all those microbes are to your host cells. And generally what happens in IBD is, as I said, is a decrease in diversity, decrease in commensal beneficial good bacteria. You start seeing microbes coming into the mucus layer, and you start seeing bacteria that can break down the mucus layer. And what happens then is that the bacteria can actually come into your cells and come across into your body. And another thing that's commonly seen in IBD is reduced numbers of bacteria that can produce things like butyrate and propionate. And people with Crohn's in particular have got this increase in proteobacteria, things like adherent invasive E. coli, fusobacterium, some cautoviruses, and some fungi. And they really are losing things like firmicutes, F. provenitzi, which produces butyrate, roseburia. And a lot of these are butyrate-producing microbes. So you're losing production of butyrate. Okay, so how do microbes interact with the host? What do they really do for us? I mean, they live there, but what do they do? Okay, one thing they do is they educate the immune system. So it's fascinating that, you know, when a baby is born and they become colonized with bacteria, and the immune system develops. And you know, one of the things the immune system does is it learns to what all the cells of the body are. That's called educating the immune system. So the immune system doesn't go around attacking a stomach cell or attacking a liver cell. It knows that that's part of the body. As a baby develops, the immune system also learns to recognize the commensal bacteria that are living in that child. And the immune system starts treating those commensal bacteria as part of the cell. So they really recognize bacteria as being part of us. I mean, we are one. Bacteria also help us digest plant material like fiber, produces energy, substrates. This is the short chain fatty acids or butyrate. They do metabolize drugs. They do produce some vitamins and antimicrobial molecules to kill off pathogens. They do produce signaling molecules to interact with immune epithelial cells, and they definitely communicate with the brain. Okay. Another thing that microbes and the immune system do in the gut is they interact to maintain a strong gut barrier. Okay, this is important because, as I said, you saw those trillions of microbes living outside. If there is not a barrier and there's a single layer of epithelial cells separating all those bacteria from the immune system, if those bacteria start coming across and interacting with the immune system will do what the immune system is supposed to do, which is attack and cause inflammation. So basically, these cells of the immune system will tolerate all of these bacteria as long as they stay outside here where they belong. Okay? They're not going to attack them on here, but if they come across, they will attack. So this is kind of a model of what we think happens to somebody who gets IBD. So you're born and you have a certain genetic predisposition. You have obviously a genetic background. But then there's environmental factors, which are really key or critical to causing the disease to develop. Things like smoking, hygiene, diet, other things in the environment. And it's believed that one of the first things that happen is a loss of barrier integrity. So you get a leaky gut. And then the bacteria start coming across into the body. They come in contact with the immune system. The immune system now gets upset, develops a memory, and will start attacking the bacteria. So we'll call it a loss of tolerance. They're no longer tolerating them because they're coming across. And then what happens is that the immune system gets very activated and more cells come in, and you get this uncontrolled immune response, and you get a lot of damage, and you get a lot of remodeling, and you get active inflammation. So going back to this point right here, trying to figure out what it is in the environment that causes the loss of barrier, and conversely, what can we do to maintain that? So somebody has a disease, but they go into remission, so they have a barrier function. How can we keep that there? And one of the things that we've seen, this is the GEM project that Crohn's and Colitis have been supporting for 8 years now. So following 5,000 subjects at risk of developing Crohn's disease, being healthy siblings and healthy offspring of people with Crohn's disease, and then looking at everything when they come into this study, they're not sick, but we take samples, and then we look at who goes on to develop IBD later on, and then look back and see what was in that person before they developed IBD. And what we have found is that out of the 5,000 people, about 80 now have developed IBD. And one of the key findings has been that they do have an increase or a breakdown in barrier function before they got IBD. And this was associated with certain kinds of microbiota. So the two seem to go together. So coming back to diet now. Diet is a main driver of microbial composition and immune function. Okay? And when you think about the microbiome and diet, you think about it this way. So all the different bacteria live in our gut. They're like different kinds of animals. Okay? They all live there, they all eat different things, but they're all living, in an ecosystem. They've all adapted to life. These guys all adapted to life on Earth, microbes in our gut. They all eat different things. Okay? If you look at a panda, they survive mainly on bamboo. But if you were to feed bamboo to all these other animals exclusively, like you feed a panda, you probably wouldn't have a dolphin. You probably wouldn't have very many tigers, and you probably wouldn't have very many eagles, because they have not adapted to life on bamboo. So think of feeding the bacteria in your gut exactly the same way. If you feed your bacteria this, a lot of processed foods, a lot of fried foods, a lot of fatty foods, what is going to happen is you're going to feed some bacteria that like this kind of food, like E. coli and Salmonella. They absolutely love this kind of food, high sugar food. But Bifidobacterium, which is a commensal beneficial bacteria, is not going to survive on that kind of diet. And something called the fecal bacterium prosmity, frequently reduced in patients with IBD, is not going to live on that kind of food. And these are butyrate producers. So if you don't feed your bacteria, the good bacteria, they don't grow. If you want bifidobacteria to grow, if you want fecal prosmity to grow, you have to feed them things like fiber. So diet, whatever you eat, can really shift the microbiome and immune profiles along a huge spectrum. Okay, and if we look, just a vegan versus an omnivore, if you look at the blood and you look at all the metabolites, so these are all the molecules floating around in the blood, and what you want to look at here is the top are all the metabolites, different kinds of metabolites now. Blue means not very many, red means a lot. And these are just a lot of people who are omnivores. And if you look at the bottom in the green, these are all the vegetarians. So, and each one of these squares is a different metabolite. So if you look at the top omnivore, you'll see that the pattern there is very different than the pattern on the bottom with the vegetarian. So quite often, where it's blue in the omnivores, it's red in the vegetarians. And you can see it's flip-flop for most of the different types of metabolites. So why is this important? Okay, these are just a bunch of metabolites. Well, these metabolites can alter your mood and brain function. A lot of these metabolites can go right into your brain, okay? But what role, coming back to the gut microbes now, have in producing those metabolites? Okay, this is the other thing that you have to remember, is that your gut microbes will transform absolutely everything that we ingest, okay? Now, you know that we're born with genetics. You know that when we eat food, it gets absorbed and our liver processes it. And, depending on what genes we have, it'll get processed a little bit different. Same with the gut microbes. Because what happens is that everything we eat has to go through your gut microbes to get into your body. So all the dietary compounds you eat, any industrial chemicals, and all the pharmaceuticals you take can get modified by bacteria that they have to pass through to be absorbed into your system. So gut microbes can increase disease risk by modifying dietary compounds towards toxic compounds. They can definitely change bioavailability of drugs. They can change toxicity of drugs. They can change efficacy of drugs. So when you think about why is it that people respond differently to a drug that they're taking, part of it is definitely your genetic background. But a large part of it is what gut microbes you have that alter the drugs that you are taking. And same with the food that you are eating. They will modify it before you get to absorb it. And they will produce a whole lot of molecules that we do not know what they are yet. And there are so many pathways of communication between the brain and the gut. It involves hormones from the endocrine system. It involves the immune system, cytokines. It involves the autonomic nervous system via the vagus nerves. And the gut microbiota can influence all of these systems. So everything that's happening in your gut, all the molecules that are being produced can make their way to the brain, can go into the brain, and the brain can send nervous systems down to change hormone secretion, to change what's happening in the gut. So microbes and their metabolites definitely can alter brain function and mood. And like I said, the two go together. So when you have normal gut physiology where there's no inflammation and you have a healthy central nervous system function, when you get stressed, when you have disease happening, when you have inflammation, you have abnormal gut function, this will feed back to the brain and alter brain activity. So in one sense, when you treat the inflammation in your gut, you can also help your brain activity. And same with when you treat your brain activity, say with some kind of cognitive type therapy, you can alter inflammation and your gut microbes. The two always go together. Just to give you an example, this was a really large study that was done in Europe on over 2,000 people. And they looked at a very deep analysis of the microbiota composition in people. And they found a direct correlation with quality of life and depression in these really large population cohorts. And again, they found that it was a butyrate-producing bacteria that were associated with a higher quality of life. And when they looked at the metabolites, again, they found specific metabolites that correlated positively with quality of life and depression. So again, and these were molecules that were being produced by gut bacteria. So bacteria, if you have the bacteria that have the enzyme to make this molecule, you will have it. But you have to feed that bacteria so that bacteria can make this molecule. So if microbes alter depression, what about probiotics? Is there any evidence for taking that? There is some for Bifidobacterium longum and Lactobacillus helveticus. And again, 3 different kinds of Bifidobacterium longum. Not a lot has been done looking at IBD specifically for depression and probiotics. It's mainly used to look at inflammation. But if you really want to look at evidence for probiotics, the best place is to go to this clinical guide to probiotic product available in Canada. Here's the link. And it's very up to date. They update it yearly with all of the products, what's in them, and what evidence there is for that particular product and where it has been studied. give you an idea of what has been studied, here's a study where they looked at taking Bifidobacterium longum in healthy volunteers and randomized double-blind placebo-controlled trial. Healthy subjects received B. longum for 4 weeks, and then they looked at neural responses to social stress. And they did this really beautiful brain imaging. And what they found that those people taking B. longum had reduced stress responses when they were given specific stressors. So what this tells you is that if you have this bacteria in your gut, you may be able to react differently to different kinds of stressors. You may be able to not be as reactive to stressors. Another one that was done in patients with irritable bowel syndrome, again, a Bifidobacterium longum for 6 weeks. And they did some beautiful brain imaging. And what they found that again, patients taking the Bifidobacterium longum had reduced depression, but no effect on anxiety or IBS symptoms. But again, it correlated with responses to negative emotional stimuli in multiple brain areas. So again, this tells you, again, that you can alter your response to stressful or emotional problems by having certain bacteria in the gut. A very large meta-analysis where they looked at all of the evidence for probiotics, prebiotics, or symbiotics for IBD, not specifically mental health, but for inflammation and disease symptoms. And again, effective in reducing disease activity in ulcerative colitis, but not Crohn's disease. Better when you use it with another drug. And combination therapy was better than just using one type, but treatments including Bifidobacterium were the most effective. And effective dosage were about the 10 billion to 1 trillion per day. So relatively high numbers. Okay, so coming now back to the gut-brain axis. We know a lot of things affect it, things like exercise, the drugs you're taking, environment, the mode of delivery, how a child is born affects development of this. Your genetics affect development, and diet. And it can influence how much you eat. It can influence your behavior. It can influence how you react to stress. Influence your fear in situations. Can influence your social interaction. And food definitely influences mood. I mean, there has been a lot of research done in this area that dietary intake can be both a risk factor and protective for depression and anxiety. Mental health positively correlates with higher nuts, and diverse vegetable legume consumption. Negatively correlates processed foods and sugary products. So the more processed foods you eat, the more sugary products you eat, the worse you feel. People following a Mediterranean diet, which we'll come to, 30% less likely to have depression, and going on to a Mediterranean diet, supplemented with fish oil, showed a significant improvement in mental health. There's been a lot of interest in looking at the role of fiber in mental health, particularly for neurodegenerative diseases, for people with Alzheimer's disease or people, so how to prevent dementia. Because one of the things we find as we age, as we get into the elderly zone, what happens is we start again losing bacteria, we start losing diversity again. And part of it is thought that the loss of diversity we see in elderly people is because they're not eating as much fiber, they're limiting the foods they eat to just a few foods. And what they're finding is when we look at this in large cohorts of people who are aging, is that those who have high dietary fiber intake They have lots of short-chain fatty acids. They have anti-inflammatory signal metabolites in the brain. They have a functional brain, and they seem to have less onset of Alzheimer's disease or other neurodegenerative diseases. Again, with immune homeostasis. And they have some associated gut microbiota back to the bifidobacterium and some firmicutes. Whereas those patients, those elderly who are not including a lot of fiber in their diet, they seem to have a much more inflammatory state. They have more chronic brain damage, and they're more likely to have Alzheimer's disease or other forms of dementia. And again, there's certain bacteria that have been shown to be associated with this. So again, brain function, it does seem to associate with the type of bacteria that we have in our gut. So we have another question for you. In the past month, have you felt sad, low, depressed, down, or hopeless? Not at all to nearly every day. Okay, so lots of us are feeling stressed, low, depressed. So next question. How often have you experienced feelings of anxiety, worries, anticipation of the worst, fearful anticipation, or irritability? Yeah. So lots of us are feeling anxious. Have you ever tried to change your diet to improve your mental health and IBD? Yes or no? So 50-50, interesting. Because I think we all know that trying to change your diet is probably one of the hardest things you can do. But it's one of the hardest things to make people do too. But let's look more closely at things like depression, anxiety. So we know that diet plays a role, exercise, a healthy immune system, and healthy microbiome are all linked with a state of health and not depression. Whereas depression can be linked with an abnormal immune system, the abnormal microbiome, stress, cytokines. And people with IBD, you've got a lot of things that, contribute to feeling depressed with anxiety. Fatigue and pain, sense of loss of control, genetic concerns, regular treatment required, unpredictable disease course, and it's often an invisible illness. So what do people do? What can you do? When you're looking at this whole puzzle thing, you have to start putting the puzzle together with things that make sense for you. Lifestyle changes are obviously a key thing. Getting enough sleep is so important. for health and for mental state and your microbiome can be difficult when you're in pain. Things like exercise. Exercise is fantastic for mental health, but how do you exercise when you're feeling totally fatigued every day and you're in pain? That's when maybe you want to start doing some therapy-based things like CBT, cognitive behavioral therapy can help. Adding in meditation can help. Mindfulness, working with a therapist to do acceptance and commitment therapy, or even talking to your doctor about going on some medications or trying hypnosis. All of these things can help with alleviating stress and with reducing some of the things that are related to anxiety. They can be done with a therapist or they can be done online. The thing is, you have to find something that works for you. And diet is definitely one piece of the puzzle that can influence a lot of these parameters. Recently, the International Organization for IBD went through all of the current literature, all of the evidence-based literature, and came up with specific recommendations for Crohn's and ulcerative colitis for both preventing disease relapse and trying to control disease activity. And for Crohn's, it was increasing vegetables and fruits and decreasing things like saturated trans fat, emulsifiers, carrageenans, artificial sweeteners, maltodextrins, titanium dioxide. Most of these things are found in processed foods, highly processed foods, the things that come in a box with a whole lot of things in the food label that don't sound recognizable because they are chemical compounds and preservatives. Interestingly, you see omega-3 oils from fish and fruit were recommended, and reducing intake of red meat, processed meat, dairy fat, and palm and coconut oil. And then the same kind of processed food things that we have for Crohn's. But one of the things that is most important for anybody to do who's looking to use food is to keep a food diary so you can identify foods that work for you, because everybody is different. So you're different because of your genes that you were born with, and you're different because of the microbiome that you have. So we all have a different microbiome. Our microbiome influences the food we eat. So there is not one diet that works for everybody. So you have to identify, you have to listen to your body. And the only way you're going to do that is to write down what you eat and symptoms. And, you know, for mental health, you want to include high fiber and fermented foods, lots of colorful fruits and vegetables, obviously stay hydrated. And you should routinely look and see if you need any vitamin and mineral supplements such as calcium, iron, zinc, vitamin B12, folic acid, vitamins A, E, D, and K. And identify diet triggers, which are different for everybody, and they can change over time. So just because you were triggered by, not triggered by something, you may get triggered by it in the future. Or you may not get triggered by something, but when you're in a stressful situation, you may now be triggered by it. So maintain that food diary and really understand how your body reacts to different types of food. Eating during a flare, potential trigger foods are, again, the sugary foods, the high fat foods, the fried foods, alcohol, dairy products can be triggers, and insoluble fiber. And for a flare, again, the lower fiber foods, fruits, the lean protein, refined grains, and things like seedless and skinless vegetables. Okay, now if we look at diets for IBD, there is a lot of diets that have been tried, none really specifically for mental health, but many for disease, such as the Mediterranean diet, specific carbohydrate diet, gluten-free diet, vegetarian diet, low FODMAP diet, and the fasting diet. There is evidence for all of these. So you can find positive studies that when people went on a Mediterranean diet, they improved their disease. Same with the specific carbohydrate diet, improved their disease. However, there are just as many studies that showed it didn't really work. So this is where you have to figure out by your own reaction to food, which one of these would be most palatable to you. For instance, the Mediterranean diet, which includes vegetables, fruits, a lot of whole grains, nuts, and olive oil, where you're avoiding high red meat intake, sweet, sugar, and processed food. Whether you would rather try that one or try a specific carbohydrate diet, where you have fruits, meats, most vegetables, but you're avoiding most grains, things like potatoes, yams, corns, and again, processed meat and dairy. These are the two that have the most evidence, and it's probably about equal evidence. So try and see how you react to it, would be the best recommendation. Okay, what about fasting though? A lot of hype about fasting right now. I mean, fasting is not new. We've always fasted. Ancient Egyptians fasted. They fasted and purged on a monthly basis in order to cleanse their bodies because they believed all illness came from the food they put in their system. Plato, he fasted for greater physical and mental efficiency. It's not new. So when we talk about fasting, there's so many different ways to do it. There is a time-restricted eating where you only eat for an 8-hour window, maybe a 4-hour window, or a 1-hour window a day. There is a restricting calories where alternate day fasting, where you have a 75% energy restriction every second day. 5-2, where you have a 50% energy restriction 2 days a week. 1 to 3 days of just water. Fasting mimicking is where you do 50% energy restriction of plant-based food for 5 days. Then there is only consuming juices and broth for an indeterminate period of time. And then the warrior diet, which is small amounts of fruits and vegetables, and then 1 large meal at night. But does it help with depression and anxiety? Yeah, there is a lot of evidence that shows that fasting does reduce anxiety and depression. It has not been studied specifically in IBD patients, however. Some of the problems is that it can lead to overeating. Like you fast for a couple of days and then you're hungry, so you eat a lot, which can cause gut pain and bloating. It's definitely not recommended for pregnant or breastfeeding women or patients with diabetes or malnourished patients. Okay, so that being said, what is a plant-based fasting mimicking diet? So this is a 5-day dietary intervention that uses plant-based foods to induce a state in the body that mimics a water-only fast. Energy is restricted to 50% of required energy. So everybody requires a certain amount of energy to maintain your body. That's your required energy, and that can be measured. So what happens in your body for that 5 days? Okay, in the first day, you're only eating 50% of your required energy. So your body has to burn something. So it starts burning your fat stores. Day 2, a metabolic switch happens in your body and you start producing ketones from burning fat. By day 3, your body starts cleaning up damaged cells and it starts activating repair pathways. And that continues and accelerates for the next 3 days. So some of the benefits that have been associated with in human studies and a lot of animal work is that just doing this 5-day period can reverse things like insulin resistance. So people with prediabetes can show to reduce tumor progression. It improves brain function, improves cardiometabolic health, and in animals, it delays age-associated diseases. So it just kind of seems like your body cleans everything up that's been damaged while you're continually putting food into it. It's like it's got time to do it, and it doesn't. So we decided at the University of Alberta that we wanted to study this diet, particularly in IBD patients, because it has never been studied in IBD patients. And there's 2 things that we wanted to look at. So the first is reducing, so fasting mimicking, reducing the energy and using only plant-based foods for the 5 days. But the question has arisen that would just using plant-based foods for the same 5 days achieve the same benefit as reducing energy at the same time? And there's some evidence that it will. So we are going to carry out a randomized controlled trial where for patients with ulcerative colitis or Crohn's disease who are in remission but still suffering from depression, we will measure your body composition and how much energy you need. And then you'll go on a fasting mimicking diet for 5 days every month. And you'll give us some blood and some stool samples so we can look at your microbiome. And you'll answer some questionnaires about how you're feeling. So if anybody is in the Edmonton region and you're interested, please feel free to contact us. Ray Olson is the study coordinator, and that's his email and the phone number you could call. This is the diet that we will give you. We'll supply all the food for the 5 days. You don't have to worry about cooking anything. We give you 2 options. So you'll get a breakfast of oatmeal or a chia seed pudding. A lunch will be a soup, minestrone, or lentil. They're very good. We do give you a little bit of meat, chicken stir fry, or vegetarian chili for dinner. You'll get 2 servings of fruit a day, different kinds. And you also get to have an almond sea salt granola bar per day. It's actually really good. I tried it and I thought the food was excellent and I wasn't hungry at all. This is just the inclusion criteria, exclusion criteria that you can look at if you're interested. And one other thing that is happening at the University of Alberta, just in case anybody is interested, is an online program designed to reduce anxiety, help with depression, help with your mental state. And what it is, it takes you through some different movement programs, things like Tai Chi movements. It includes breath work and mindfulness practice, and it includes psychology tips and games of how to live with a chronic condition with IBD. There'll be weekly educational tips from clinical experts, and you really will be part of an online community because you'll be doing it individually, but kind of within a group setting. We did a pilot last year and it worked really well, made some modifications. So if anybody is interested, you can do it from wherever you are in the country. It's a 12-week program. You can scan and just pre-register. Anybody can participate. And it will be starting in January, just in case anyone's interested in doing something like that. Okay, so I'm just going to summarize that I really hope to convince you that gut microbes really do regulate immune, metabolic, neural, hormonal status of the host. and really can significantly affect your brain function and mood. It is an ecosystem. It's continually modulated through diet and environmental factors, and you really need to take good care and feed your microbes. And I predict that in the future, your microbial profile is going to be in your chart, and personalized healthcare will include tracking changes in your microbiome. And therapy is going to be aimed at both the host and the microbiome. And we're going to use things like diet, probiotics, prebiotics, or defined cocktails, really to help improve our health and reduce susceptibility to disease. But really, diet is really critical that we can all do pretty easily to help improve our mental health. And on that note, I will end and say thank you very much, and I'm happy to answer any questions. Okay.
Wonderful. Thank you so much, Dr. Madsen. That was a really, really insightful talk, and it's always a popular topic. We get lots of questions, from different members of the IBD community, about the microbiome, about diet. So let's get into the question period. Thank you to everyone that registered for the webinar and submitted your questions ahead of time. And thank you to those that have submitted your questions during the live broadcast. We will do our very best to get to everyone's questions this evening. But if you don't get your question answered, please do email us at learn@crohnsandcolitis.ca, and we'll make sure to get back to you directly. So the first question is, are people with a brain injury more prone to developing Crohn's disease or ulcerative colitis?
Yes, they are. It's very simple. People who suffer traumatic brain injury really commonly develop GI problems. And quite often that will turn into colitis. And one of the main problems for this, the main reasons for this, they believe, is that there's increase in gut permeability or breakdown, leaky gut after a traumatic brain injury, which again allows bacteria to come into systemic circulation, causing an inflammation, which eventually then does turn into colitis. So yes, they are definitely more prone.
So if there is an individual, that has had a brain injury, should they be screened for something like Crohn's disease or ulcerative colitis, or how should they go about that?
They will definitely have symptoms of it. I mean, they'll have diarrhea, they'll have abdominal pain, they may have motility issues. So yeah, it will be very apparent if they have developed it. And it is very, very common.
Oh, okay. Thank you. And so for the next question, how could people who have undergone surgery for the gut, for instance, an ostomy surgery, how can they alter their diet to help with their mental health?
Yeah, I mean, that's kind of a complex question because it kind of depends, how soon after surgery, how stable you are. And I would say for this is that you really want to eat a variety of foods if you can. And you may tolerate smaller meals and snacks better than large meals. And again, you want to include fiber if you can. Some people can't. But if you want to include fiber, things like soluble fiber is usually tolerated better than an insoluble fiber. Things like oatmeal, oat bran, barley, legumes are kind of better than an insoluble type of fiber. And again, a lot of trial and error keeping a food diary. Possibly omega-3 supplements too might be helpful to help with our mental health. Okay.
That's great. Thank you, Dr. Madsen. And I know that you mentioned, having a food diary. So maybe I'll just take this opportunity to encourage those that haven't already to download the Crohn's and Colitis Canada mobile My Gut app. It can be used to track your food and symptoms. Okay, next question, please. How can someone get started on a plant-based diet when they have IBD? Do you have any sort of tips? Like, what are some foods for someone to eat every day if they were to start this type of diet?
Start slow and small, right? It's not that hard to start incorporating plant-based meals. Like, only put in a new recipe slowly. So wait 1 to 3-4 days, see how you react to it, and see how your body tolerates it. Like, try, if you kind of like what we did for the plant-based fasting mimicking diet. So we made a chili, which people tend to like, but we put in like kind of meatless lentil type of products. And it tastes like chili, and it kind of has the texture of chili, but it doesn't include meat, right? So that's plant-based. Again, something you like, something, put it into smoothies, right? That's a great way to make things are very palatable, is to put it into smoothies. But again, slow and small, one recipe at a time, with things you like. And anybody wants our recipes, I'm happy to send them to them. Just let me know.
Wonderful. Thank you. Okay, next question. How can someone who has dealt with, maybe disordered eating in the past, how can they, control their diet to manage their IBD? Do you have any, recommendations for those types of individuals?
Yeah, I think if you've had problems with disordered eating in the past, it's probably best to manage this really professionally with a dietitian. And if it was a diagnosed eating disorder, to put the two together, your eating disorder team with your IBD team, and really, get them to help you do this. I think this is something that is best getting help with, rather than trying to do this on your own.
Yeah, thank you. Next question. How can you cope with loss of appetite? I'll maybe start with that question, because that's sort of a question that we get often, for how to stimulate appetite, how to manage and ensure you're having a nutritious diet when you don't really feel like eating. And then maybe for the second question, we can go to issues with children and diet.
Yeah, I mean, this is so hard because kids, when they get IBD, they quite often feel totally powerless. I mean, they've lost all control of their body, they've lost control of their life. They eat food and they feel sick, right? And so they don't want to eat anything. So, I mean, how do you help that? And kids could be notoriously difficult with food anyway. Maybe trying to give them as much control back and responsibility in their own diet. So get them involved with meal planning, take them to the grocery store, help them pick out, what it is they want to eat. And again, help them keep a food journal so they learn themselves, depending obviously on the age of the child. And just things like having a regular family dinner and the rest of the family eating kind of the same foods that the child has to eat. Things like, again, coming back to the smoothies, you can make delicious smoothies and get a whole lot of, really good nutrients in smoothies. Sneaking food in nutrients is great from doing it that way. Juicing, pureeing, anything that you can sneak nutrients in and make it taste really good helps. Other than that, just things like, there was one question, if your child is, being anxious or something, that you may look at what they're eating for snacks and may have a complex carbohydrate, so you don't have things like spiking blood glucose and then lowering your blood glucose, coming up with irritability, anxiety. So again, snacking on high protein, high complex carbohydrate type of snack, right? Something like that. But it's so hard with kids.
Yeah.
But it really, I think, helps to give them back a choice as much as you can in what they want to eat.
For sure. Okay, thank you. And there is a question that was asked live that maybe I'll plug in now just to ensure that we have enough time. So many patients with IBD, if they're experiencing an active flare-up, they may be recommended by their GI to limit their intake of fiber. And so some are wondering, do you have any recommendations for still integrating fiber within the diet, given its role in the microbiome? And, for example, maybe a fiber supplement, would that be effective?
Yeah. Again, you can, some of the fiber supplements, like the psyllium, is a soluble type fiber. That's probably easier to tolerate than insoluble fiber, because there's a lot of different kinds of fiber. So the type of fiber that you take will again interact with the type of gut microbes you have. So while one person can take one particular fiber and have no issue, another person may take it and have a lot of gas. Okay? Because they've got the bacteria with the enzymes that can make gas from that particular fiber. But stay with the soluble fibers, things like I said, the psyllium maybe, or maybe the inulin. But try it first. Like, again, start slow. Don't go out there and take a whole bunch of fiber, because your body may not be used to it. So start slow and increase gradually. And you may get gas for the first couple of days, and that tends to go away, because what happens is you are taking a fiber supplement, the bacteria make gas, it then feeds other bacteria that feed off that gas. So then they will proliferate, and all of a sudden the gas that those bacteria are making are now being used by another bacteria. So you have no more gas. So that's what's happening.
Okay, thank you. Next question. Food and IBD medications affect the gut-brain connection. So how can people with Crohn's or colitis control how their diet and medications work together or against their state of their mental health?
Yeah, exactly, because everybody is so different. That again, there's no one diet for everybody. And because there are so many interactions, whether you're under stress, whether you're in remission. So you just kind of got to go with the general, that diagram that I put up, where they have increasing fruits and vegetables for Crohn, increasing the omega-3 containing foods for ulcerative colitis. And just go with those kind of general recommendations, keeping track of what works and what doesn't. And that's the best you can do. Listen to your body, and never be afraid to ask for help or to talk to a dietitian. Your GI guy should be quite willing to refer you to a dietitian for help, and talk to them, right? Get help. Never try and do all this by yourself.
Thank you. Next question. How does eating meat affect depression and anxiety in people with IBD?
This is really interesting, because a couple of years ago, there were all these headlines saying that omnivores, people who eat meat, had less depression and anxiety than vegetarians. So everybody should eat meat and they won't be depressed. There's all these headlines everywhere. So what is actually the truth? Well, in those studies, they did show that omnivores had less depression. One of the things the researchers thought that may contribute to this is that vegetarians quite often have nutritional deficiencies, particularly in vitamin B12 and iron, which can lead to depression. So they thought that that might be one thing. However, that being said, when you look at specifically red meat consumption, showed that there is a positive correlation between high levels of red meat and depression, anxiety. So the more red meat you eat, the more depression, anxiety you can have. Now, that can be due to inflammation because red meat can induce more inflammation. This does not hold true for white meat like poultry. There is no correlation whatsoever between poultry and depression. The other thing, when you think about diet studies, when you see something like this, is that, okay, so you say eating red meat, I get depressed. Well, when you're eating one thing, quite often you're not eating something else. So it's not the fact that it's red meat causing depression, it's the fact that you're not eating vegetables and fruits. So you don't have those molecules like butyrate, which help you not be depressed, right? So it's not the presence of something, but it's the absence of something. But it has been also shown in several studies that a little bit of meat in the form of lean meat, like chicken, whatever, is better than no meat for mental health. So,
And you mentioned the Mediterranean diet as well. So would fish also be a good option
yes,
to integrate?
absolutely. Fish
Okay.
is always great to, as a protein source, absolutely. With all the omega-3s, yes.
Yes. Yeah. Thank you. Okay, next question. How can someone ensure that they get all the required nutrients to help with their mental health during a flare-up if they have a restricted diet? We talked a little bit about this earlier around, reduced fiber intake, but do you have any other recommendations?
Yeah, I mean, you got to try and rotate as many different foods that you can, tolerate. Don't just eat one food. Eat as many different types as you can. Definitely don't have the processed foods. Swap any processed food with whole foods. Definitely fresh whenever you can. Again, looking at supplements, you may have to be taking vitamin supplements, mineral supplements during this time. That's about it, really. Rotating food, whole foods, and supplements if necessary.
Okay, thank you. So I think that's it for the questions that were submitted ahead of time. I think we have maybe time for just one last question that was submitted through the chat. And for those of you, again, that haven't gotten your question answered, please do email us at learn@crohnsandcolitis.ca, and we can follow up with you there. So the last question for this evening is, given the differences, genetic differences across different ethnicities, should people living with IBD that are coming from different cultures adopt different dietary approaches?
That's a great question, because the people who come from an area of low IBD to, say, Canada, which has high IBD, it doesn't seem to affect them in their lifetime if they're an adult when they come. But if they come when they're a child, it definitely increases their risk, and their kids will have the same risk as those that live here. So yeah, it depends on the age, and then yeah.
Great, thank you. Okay, so so much, Dr. Madsen, for joining us this evening. There are many thank you remarks from the audience members and everyone. It was lots of questions this evening. So please, again, get in contact with us, and we'll get back to you if your questions weren't answered. And moving along to the next slide, we just have a few slides here to wrap up. And a few polls just to gauge your knowledge now after the presentation with Dr. Madsen. So how would you rate your current knowledge of the gut microbiome in IBD? Again, from a rating of 0 to 6, 0 being none and 6 being excellent.
I hope it goes up.
Well, it looks that way. I was, taking a look at the start of the presentation.
Or I have.
So I think, so it looks like people are reporting, high, very high to excellent, somewhere in the moderate. So again, we will share a link to this presentation tomorrow. We will email it to you to the email that you used to register for this evening's webinar. We will also post it on our YouTube channel at Get Gutsy. So if you'd like a refresher, we encourage you to watch the webinar. And that will be it for this evening. Thank you again, everyone, for joining us. And Dr. Karen Madsen, thank you very much again for your wonderful presentation this evening.
Thank you, everybody, for coming and for submitting your questions.
Bye for now.